globo en la parte inferior de su pantalla. All right, we are live on Facebook, and welcome. My name is Kate Cole with Public Health Seattle and King County, and we're here with our health officer, Dr. Jeff Duchin. He'll be giving us an update on COVID-19, and then we'll take questions from the media. I'll turn it over to you, Jeff.
Thank you, Kate, and good afternoon, everyone. Thanks for joining today. As we head into the holiday season, I want to reflect on where we've been as a community over the past year. It has been an incredibly difficult year, and an unimaginably difficult year. The COVID-19 pandemic was just discovered this time last year with an outbreak of unexplained pneumonia in Wuhan, China. And this pandemic continues to take a terrible toll across our nation, in our state, and in our community. Too many of us have had to cope with the death or illness of a loved one from COVID-19. And I want to extend my sincere condolences from myself and from our public health team to all who have been touched and who had loved ones affected and lost loved ones, family members, friends, coworkers, colleagues, community members. We think about you every day. At the same time, the economic and social impacts of this pandemic have compounded the suffering and pose additional health impacts for people of all ages. So I want to thank all of you for doing what you can to prevent the spread of illness at this time and the further spread as we go into these difficult winter months. Now, I know many of you joined me and changed your Thanksgiving plans and gathered more safely to help protect the health of your families, your loved ones, your friends, in our community. And I believe those actions and the effect of our recent restrictions in Washington have helped limit the spread of COVID-19 over that holiday weekend. Continuing to practice COVID safety in all aspects of our lives will be essential to protect our hospitals from becoming overwhelmed, as is happening in many parts of the country. I'll now share with you an epidemiology update, some of the latest numbers, some thoughts, and then I'll welcome your questions. As of this morning, we've had 51,671 cases of COVID-19 in King County, 3,543 hospitalizations, and 920 deaths since the outbreak was recognized in February. Our 14-day incidence rate is approximately 400 per 100,000. Our cases and hospitalizations remain elevated and stable at high levels since late November. We're seeing approximately 650 new cases daily over the past 7 days, approximately 19,000 new cases in November. And remember, these cases don't represent all the cases in the community. They represent those that get tested and diagnosed. For each of these, there are several more that we don't get recognized and recorded. So our current rate is down slightly from the peak just before Thanksgiving. Over one half of our cases, approximately 60%, are in the 20 to 50-year-old age range. 20%, or 1 in 5 of our cases, are in their 20s, and 20%, or 1 in 5, are in their 30s. We have seen a sustained increase in hospitalizations throughout November, with almost 30 people hospitalized per day over the last week. That's up from 50 per week during the summer and through October. The number of hospitalizations is highest in the 40 to 69-year-old age range, followed by the over 70-year-old age group, and then the 20 to 39-year-old age group. There are approximately 350 confirmed and suspected COVID-19 patients hospitalized in our King County hospitals right now. Over 80% of our hospital's acute care beds are occupied, and 10% of those are with COVID-19 cases. 81% of our intensive care unit beds are occupied, and about 20% of those beds are with COVID-19 cases. The increase in COVID-19 deaths, the gradual increase that we had noted since mid-November, has accelerated recently. Our most recent weekly numbers show an average of 7 deaths daily. Previously, that was under 2 deaths per day since September, 7 a day. We've also seen a record number of outbreaks reported in November, 209 outbreaks identified, the highest count since the beginning of the pandemic, and a 30% increase over October. The largest increases were in long-term care facility settings, child cares, and homeless service sites. In November, 61 new long-term care facility or supported living outbreaks were identified, matching the volume observed last March. This also represented a 97% increase compared to October, when 31 outbreaks were identified. And the number of outbreaks reported from child care centers has tripled in November to 37 compared to 12 in October. We've also seen an increasing number of healthcare worker infections, 750 in November. This is the highest number since the outbreak began. I want you to also understand, though, that healthcare worker infections represent less than 4% of the total COVID-19 infections in the community now, as opposed to 18% of the COVID-19 infections in the community back in March and April. So the proportion of infections among healthcare workers has gone down, but the number has gone up. 1/3 of our healthcare worker cases are in nursing staff, and caregivers, which are representing about 13% of our cases, followed by medical staff at 5%. And most of our nursing staff and caregiver infections occur in the long-term care facility settings. Now, although the momentum of our outbreak has slowed over the past 2 weeks, we continue at a dangerous and unacceptably high level of COVID-19 transmission. Our hospitals are stressed, and they're canceling surgeries, and they're continuing to develop emergency staffing plans and prepare for the possibility of a worsening crisis. And it's terrifying for me to think that any one of us or our loved ones would not get the life-saving medical care we expect if we needed it. But that remains a distinct possibility, and we all need to understand the reality of that fact if we are to avoid it. But it is encouraging that we appear to have stabilized recently, and it tells me that the restrictions are working, and I want to say thank you to everyone who's continuing to limit their gatherings and take extra care to prevent COVID-19 spread at this time, especially during the holiday season when it is especially tough. We must continue to do everything we can to stop the spread of this virus so we can return to doing the things we want to do and we need to do more safely. But the painful reality is that COVID-19 continues to pose a deadly threat, both locally and nationally. The virus is not going to relent in the next few months, and we can't either. There are over 200,000 cases each day in the US, with 2 Americans dying of COVID every minute. Our country is burning up with COVID. Because of this, we need to understand the significant risk of being exposed to COVID-19 during travel at this time. For those who do travel and for anyone exposed to someone with COVID-19, quarantine is an important tool. And we have recent guidance on our website, and the CDC has issued recent guidance I encourage you to review. If you're going to gather for Christmas, gathering with the household, people who live in your home is the safest way, with your own household members. And if you must gather with others, this is the time to start your quarantine, to be sure your gift to someone you love isn't a COVID-19 infection. Now, there is some good news. In the face of all this adversity, it's easy to lose sight of the fact that there are things we can all do to reduce the spread of COVID-19 and the associated harmful health and economic impacts. Recent steps taken by many of you in King County likely blunted the rise in cases we were anticipating. Also on the good news front, the CDC, our nation's health agency, appears increasingly reinvigorated and has issued a series of valuable updates, guidance, and information for the public, including on travel, schools and childcares, workplaces and businesses, improving indoor ventilation, and how to celebrate holidays safely. They've also announced a new director, which is very exciting to many. I'm hopeful we'll get desperately needed support at the federal level to address the very real implications of economic instability and job loss. We need federal wage assistance for employees or paycheck protection for businesses, and we need it now. Pandemic unemployment assistance ends on December 30th unless Congress acts to extend it, and our public health response will be in a similarly precarious situation. And I know our state delegation, led by Senator Murray and her team, are working on this for us. Also on the good news front, yesterday, a Pfizer and BioNTech COVID-19 vaccine was recommended for emergency use authorization by the FDA's external independent advisory group of experts after a transparent, public, and thorough review of the data. And they concluded that the benefits of that vaccine outweighed the risks. Now, with respect to vaccine planning, many of you know the State Department of Health is the lead agency responsible for vaccine distribution and allocation in Washington. And we are working closely with DOH to build the infrastructure necessary to have a successful vaccine implementation program in King County. We've heard from DOH that the first supplies may be arriving as soon as next week, and we know that early weeks and even early months, supplies will be limited, and they're going to be allocated first to specific groups at highest risk, such as high-risk workers in healthcare settings and workers and residents in long-term care facilities. And I know many of you understand that the majority of deaths, both nationally and locally, have been in residents of long-term care facilities. Other groups that will likely be prioritized before the vaccine is available to all of us include essential workers and high-risk adults with specific health conditions that put them at risk, and adults 65 years and older. Rolling out a COVID-19 vaccination campaign during an ongoing pandemic is a massive undertaking. It includes planning for new vaccine distribution and administration venues, recruiting and training community-based healthcare workers to administer vaccine, providing vaccinators with support and technical assistance, doing robust work in our communities around public information to build trust and answer questions about vaccine safety and effectiveness, and ensuring equitable access across the community. So I want to say a little bit about COVID-19 vaccines and safety and the whole approval process. COVID-19 vaccines are being developed more quickly than other vaccines. And that's because we're in a public health emergency, a global public health emergency. But this may concern people that may feel that some of the scientific steps were skipped in the process. And I want to reassure you that that's not true. All vaccines, including COVID-19 vaccines, must go through multiple phases of testing for safety and effectiveness. The main reason why COVID-19 vaccines are becoming available more quickly is that due to the pandemic, vaccine developers were given funding by governments to conduct several of the required development steps at the same time, as opposed to one after the next, as they usually do. And because vaccines are being produced at the same time they're being studied, so that if they are shown to be safe and effective and are approved, the doses will be available right away. Now, the two leading COVID-19 vaccine candidates, including the one that was recommended for authorization yesterday, are also the first vaccines using a new technology, a new mRNA technology, which is an exciting development. And these vaccines are exciting for a couple of reasons, including that they do not contain a virus, they do not and cannot cause an infection. What they do contain is a molecular blueprint, which is mRNA, which instructs our cells to make a protein that's similar to a protein found on the surface of the coronaviruses. And our immune system then develops a protective response to that protein. When we use vaccines like measles, mumps, rubella, MMR, or varicella vaccine, those viruses in those vaccines contain their own mRNA that is replicating in the body after the vaccine is injected in the same way that this mRNA replicates. But in this new vaccine, there's no virus involved. It's just the mRNA that produces the protein. So it's more simple in that sense. These vaccines have been studied in tens of thousands of volunteers. The vaccine under consideration for authorization today, it may even be licensed, or not licensed, but approved, authorized for use later today. This vaccine, the Pfizer vaccine, has been studied in approximately 40,000 clinical trial subjects, volunteers, to test the vaccine. And the data on vaccine effectiveness and safety are reviewed and were reviewed yesterday at a public meeting, and they're reviewed by two independent advisory groups of medical experts. They don't work for the government, they're outsiders. One works for the FDA, and it's called VRBPAC, and the separate group, the ACIP, works for the CDC. And these groups make recommendations regarding approving vaccines and how to use them once approved, respectively. And I should say, when I say they work in service of. They are not government employees. They are independent experts from medical and public health careers that are volunteering to do this work. They're not part of the government. They make recommendations, and that was done yesterday and will be done by ACIP possibly this weekend. And I should tell you, some of you probably know, I'm a member of the ACIP COVID-19 vaccine work group that is currently formulating guidance. Now, the vaccine that is expected to be approved shows very high levels of effectiveness during the clinical studies and has not shown serious safety problems. And ongoing safety monitoring will be extremely robust and be a very important part of the national vaccination program. And new information will be evolving and coming about and available as other vaccines apply for approval and distribution of approved vaccines begin. We have a webpage where we're adding new information and frequent updates as it becomes available. There's also videos about the vaccine, including how they're being developed and how they function in our body. That video is available in 18 languages at kingcounty.gov/COVID/vaccine. So what can we do now? When vaccine becomes available, it is not going to stop this outbreak in its tracks by any means. It will be one of a number of tools that will be important in helping us bring this outbreak under control. But it can be a very important tool, particularly if many people are vaccinated. But it will be many months before enough people are vaccinated to stop the outbreak. And in that time, we must understand that it's essential to continue taking all the same precautions around mask use and limiting our close gatherings with others and staying away from crowded indoor air spaces and improving ventilation that we are taking currently until the time that the virus transmission is suppressed to such a degree that we can consider easing up on those precautions. So stopping the pandemic is really going to require a variety of tools, including vaccine. And vaccine may be the beginning of the end, but it's not going to be the immediate end of this outbreak. And finally, I want to let you know that we opened a new test site in Enumclaw yesterday. And on Tuesday, December 15th, we'll be opening a new test site at Bellevue College in Bellevue. And we do encourage people to register online before going to the test sites so that we can serve you as efficiently and as quickly as possible. So with that, I will stop and be happy to welcome your questions.
Great, thanks, Jeff. And as a reminder for media, if you have a question, please use the raise your hand function in Zoom. And first we'll hear from Carolyn Bick. Go ahead, Carolyn.
Great, thank you very much. I appreciate it. So I wanted to ask, obviously South County continues to be a hotbed of COVID-19 activity. And as you just mentioned, I know a new testing site recently opened in Enumclaw, but are there any other measures public health can or is planning to take to help mitigate the spread over the next several months, seeing as, it is projected to get much, much worse before it gets better?
Yeah, thanks for your question. We are, I think that your question really illustrates the need to continue to do everything that we're currently doing and try and enhance our activities as much as possible. One of the challenges we have is the fiscal cliff that we're facing because, as you know, we have not been funded, for example, to do the vaccine implementation program. We're waiting for the stimulus dollars that we can use not only to build our vaccination program, but also to enhance many of the other activities that we're doing, including testing, community outreach, isolation and quarantine with contact tracing and so on. So to the extent that we can build our team and enhance those activities, I think we'll all be better off. And I'm hoping that we're able to do that very soon.
Great. Next question is from Nick Popham.
Thanks so much again, Dr. Duchin, for always doing this for us. We appreciate it. So the positivity rate right now, last time I looked, was at around 9%. As you mentioned, cases are over 400 per 100,000, that 2-week case rate average. Is it even possible, do you think, for us to get back down to below 25 in the next month or so, or is that just kind of a pipe dream at this point?
Yeah, thank you, Nick. I don't think we can get to 25 in the next month without extreme hardship. I mean, basically, this virus moves from person to person when we are in close contact with one another. So in order to drop it that quickly, we would just all have to stay apart from one another in every aspect of our lives. And I think that, we're not willing to, at this point, give up some of the essential work that's happening in the community, some of the essential services that we need to carry on our food transportation and other critical infrastructure and so on. To get to that level that quickly, it would really require people just don't come in contact with one another virtually at all. So what I do think we can do is turn this around by not relenting. The virus isn't going to relent. We can't relent on the basic measures. We can turn it around by all wearing masks whenever we're around others outside the home, by limiting the number of interactions we have with others, avoiding crowded indoor spaces, minimizing gatherings, not traveling at this time because there's so much COVID everywhere in the country. Your risk of being exposed to COVID is quite high. Quarantining when you're exposed. I mean, if we do all the things that we know, the steps that we know work, we can get this outbreak turned around, and we can definitely get back down to 25 per 100,000 and even lower. I mean, I know that if people are conscientious and enough of us take these steps, we can bring this outbreak down to a low level. And with vaccine, we can effectively suppress this virus to a degree that we can get back to doing a lot of the things that we want to do and we need to do. But the extent to which we take these steps will determine how quickly we get there or we don't get there. And if we decide to relax like we did over the summer, we're in a very dangerous position. We're at a much higher level of disease with a much higher level of transmission, and things will get worse much more quickly over the next month or the next 2 months if we don't take these steps seriously than they did over the summer.
Next question is from Simone Del Rosario.
Hi, Dr. Duchin. Thank you so much for answering these questions. You spoke about the safety of the vaccine and needing to get that message out. Today, there are multiple media reports that the White House has pressured the FDA to finalize approval for emergency authorization by today, threatening the FDA chief's job. What's your take on politics being injected into this as a health expert that's trying to represent the best information out to the public?
Well, it's extremely unfortunate. I mean, the process was going along perfectly. It was going along just like it went along for any other vaccine until this happened. The external advisory committee to the FDA, the independent experts met yesterday. They reviewed the data yesterday. I was participating in that the entire day. It was a thorough vetting at a public meeting of all the information. They voted, they recommended that this vaccine be used, and it was on the path. Everyone believed it was on the path to approval. Why The politics has to get involved now, the politicians, the administration, and potentially undermine the confidence in the process is mind-boggling to me. And the process was working, and the process is still working, but the perception now is compromised. The perception of the process is totally compromised. I will tell you, though, that based on my personal participation in these meetings, that the vaccine was on track for approval, and we anticipated it to be approved this weekend. So I think the White House's meddling is unfortunate. It's distracting. It undermines confidence, but it's not going to affect the process in any way because the die was cast already. In addition, there will be another completely independent scientific advisory body reviewing these same data. We started today. This is the ACIP, the Advisory Committee on Immunization Practices to the CDC. The ACIP reviewed the data today. They're prepared to vote on the information that FDA may put forward in an emergency use authorization as soon as tomorrow, if that happens. And I think that if you saw the ACIP meeting today is another public meeting, the reaction to the data was very favorable. So I can assure you that the pressure from the White House is in no way influencing the outcome of the scientific process. It is probably influencing people's perceptions of the process, but I've been involved in the scientific process, and I can assure you that it's gone just the way it was supposed to go.
Thank you. Next question is from Evan Bush. Evan, go ahead.
Hi, thanks so much for taking questions. In a recent UW webinar, immunization manager Libby Page mentioned that King County needed an estimated $4 million, or public health, Seattle and King County needed an estimated $4 million for 30 additional staffers for a successful vaccine rollout. And that figure didn't include supplies for county vaccination clinics. Do you plan for county vaccination clinics? And is that $4 million and 30 additional staffers the correct numbers?
As far as the correct numbers, I'm going to have to ask our team to follow up and see if there's been any change since Libby's estimate. Because, Evan, to some degree, we're still negotiating with the state, what the allocations will be, where the vaccine will go, and what the ultimate need will be for the healthcare system versus the public health system. But we absolutely know that we will have to do some vaccinating to reach those hard to reach populations, people who may not be affiliated with the healthcare system, and to ensure equity in distribution of this vaccine through all communities. So we are planning to stand up immunization activities for COVID-19 clinics or points of distribution, and we are waiting to find out, from the state, how much vaccine we will have available, how much vaccine our partners will have available, where those doses will be allocated, and then we will, make more concrete plans that we can share with you about, times and places and so on. But at this point, we don't have any vaccine in hand, and it's a good opportunity for me to remind everyone that, this whole business is very uncertain. There's a lot of uncertainty associated with every aspect of the COVID-19 pandemic, as you know, related to the organism, the virus itself and how it works and what it does, but also related to vaccine as it's developed quickly and rolled out. And there's uncertainty around production, numbers of doses. There will be multiple vaccines available at some point. We'll have to see which combinations we get here locally and how that impacts the logistics around vaccine implementation and rollout. And then there will be unanticipated snafus, I guarantee you, along the way, like the one that happened this afternoon with the White House compromising the public's confidence in the process. So there will be a number of challenges that are unanticipated, and I expect that. But I think one thing that won't change is our commitment to stand up public vaccination clinics for those prioritized groups that don't have good access to it otherwise.
Thanks. Now I want to take a question from one of our Facebook Live viewers. They're wondering where in the vaccine prioritization process elderly people with comorbidities fall, and specifically asked if they fall within phase 1B.
Thanks for the question. That guidance has not been finalized yet. So what we have currently a recommendation from the advisory committee to the CDC and accepted by the CDC is only for phase 1A, which is healthcare workers at high risk. That means healthcare workers who have face-to-face contact with COVID patients or suspected COVID patients. And it's not just what you might think of as a healthcare worker, doctor, nurse, et cetera. It's healthcare personnel, people who support the care, nursing assistants, respiratory techs, environmental services, people who have to be in contact with patient care environments where the virus may be present. So we want to make sure we cover everyone at risk. And as I told you earlier, the group that's at highest risk here and nationally are nurses. And there's also other support staff who've had infections. So we want to make sure that the vaccine is equitably distributed within healthcare systems in a way that represents the risk of the actual healthcare workers, so that, for instance, healthcare workers that are not having patient contact at the moment, would not be prioritized in 1A.
Thank you. Next question is from Jessamine McIntyre.
Thank you very much, Dr. Duchin. Really appreciate your time. If this FDA does go ahead and approve that, as the White House has pressured today, what would that do to the timeline in delivery of the vaccine? And when it gets here, when it comes to high-risk people, healthcare workers, and long-term care facility patients and residents, are those getting simultaneously injected, or does it go healthcare, then long-term care residents?
Mm-hmm. Thanks for your question. So the process works like this. When the FDA approves, it's more authorizes, it's an emergency use authorization. This isn't the usual vaccine licensure pathway. This is an accelerated process, as I described, because we're having a public health emergency. And so what's issued is an emergency use authorization. And the basis for that is that the vaccine's benefits outweigh the uncertainties, the risks, the safety, any safety considerations. But ultimately, more information will be presented to the FDA, and the vaccine will be licensed in the traditional fashion. So what we get first will be vaccine available through an emergency use authorization. And that was basically well along the way before the White House got involved in pressuring. The process was, as I said, the die was cast on that one. So it's more, I think, symbolic what the White House is doing than meaningful. In any case, once it is authorized, then the CDC's Advisory Committee on Immunization Practices needs to make guidance. First of all, they need to review all the data, make sure they agree that this vaccine should be used. So authorized means it's legally available, but then there has to be recommendations to healthcare providers, which are made by the ACIP. The ACIP will then determine, after reviewing the data, in which populations the vaccine should be used, and guidance for healthcare providers and how to use it. At that, I think probably simultaneous with that, the vaccine will be shipping, that's the plan, across the country to those healthcare providers that the states have enrolled in their vaccine implementation and distribution programs. And once the ACIP guidance is available, vaccination programs can start to use the vaccine. The The long-term care facilities is a little more complicated because they have a slightly, they have another option. So there's a pharmacy program where long-term care facilities nationally were able to sign up with a pharmacy partner who would then deliver vaccine to the facility, which is a tremendous benefit, and to vaccinate not only the long-term care facility residents who want vaccination, but the healthcare workers, which is critically important. So there will be vaccine available separately through a separate stream that will go through the pharmacy program to long-term care facilities. However, we anticipate that not every long-term care facility, because that encompasses a large group of types of facilities, from nursing homes, skilled nursing, to assisted living, supportive living, and so on. Not everyone will have access to the pharmacy program, and many healthcare workers in particular may not have access to healthcare systems that are providing vaccine initially. So we want to be able to supplement that with our healthcare system partners. We want them to be able to help immunize long-term care facility staff and or residents. And we will also be assisting with that at the county. So your point was the timing. So the long-term care facility pharmacy program is logistically more complicated. It involves getting consent from all the residents in advance. And so that will probably lag behind the availability in the healthcare systems by a week or two. And I would probably refer you to Washington State Department of Health to get the details, because they're the ones who activate the system, and they determine, the timing around the delivery of vaccine, and would be able to give you the most current information on that.
Great. And our final question is going to be a question from community. It's asking whether public health will work with community organizations on direct outreach to community about vaccine education and opportunities to get vaccinated.
Absolutely. We have had ongoing, first of all, this is critical. We want to make sure that if we have a safe and effective vaccine available, people have the best information possible to make a choice about whether they want to be vaccinated. And we hope people will choose to be vaccinated with a safe and effective vaccine, because it will not only protect them, but it will protect others in their homes, their workplaces, their friends, family, loved ones, and their communities. But we understand absolutely and completely that people need to have their questions answered. They need to understand and trust the process. So we will be using our existing community engagement staff to be pushing out information about a vaccine, to be making a vaccine information available in multiple languages. And I have a feeling I will end up doing Q&As, forums with community stakeholders to help answer questions. We will have information on our websites, and we very much understand the importance of this, and welcome suggestions on how to work with community to get those questions answered, so that everyone can make a good, well-informed decision about how to protect themselves and their families and loved ones.
Great, thanks so much. Any closing thoughts, Jeff?
I would just again like to express my my understanding and compassion and empathy for what everyone has gone through in this past incredibly difficult year, this unimaginably terrible situation, both here nationally and globally. I know we have connections in other states and in other parts of the world from our own community, and this is difficult everywhere. I want to thank people who are doing what they can to do the right thing. The more of us that understand how this virus spreads, that it will not relent until we get it under control with vaccine and our behavior, the better off we'll be. And please remember to the fundamentals: wear a mask whenever outside the home, limit your activities outside the home, keep 6 feet at least of distance, avoid crowded indoor air spaces, keep your gatherings as small as possible, and we will get through this. It's going to be a challenging few months. These will be the most difficult few months that we've faced so far, but if things go well, I'm optimistic that the vaccines are really going to speed the end. They won't be the end, but they will be the beginning of the end, I hope. So thank you again. Really enjoy speaking with all of you. I look forward to the time when we can do this in person and when you don't care to talk about COVID anymore. That'll be a great day. So thank you.
Excellent. Thank you